Today, we're going to dive into something called enamel hypoplasia. We're going to talk about what it is, where it comes from, and probably most importantly, what you can do about it to keep your smile healthy. So let's get right into it. You might have seen them on your own teeth or maybe even on your kids' teeth. It's actually pretty common, and it definitely makes you wonder, what is that? Well, we're going to break down the answers for you right now. So first things first, what exactly is enamel hypoplasia? Well, it all has to do with that super important protective layer on the outside of your teeth. To put it simply, it's a condition that happens while the teeth are still developing. That hard outer surface, your tooth's enamel, just doesn't form all the way. This means it can end up being thinner or weaker than it's supposed to be, which leaves the tooth a little vulnerable. A really great way to picture this is to think of healthy enamel as this strong, smooth suit of armor. Enamel hypoplasia, then, is like having a dent or a weak spot in that armor. And that dent in the armor, it isn't just about how it looks. It can cause some real issues, like making your teeth super sensitive to hot or cold things. Ouch. You might also see some discoloration, and because that shield is weaker, it means you've got a much higher risk of getting cavities. And, if you don't take care of those, it can lead to bigger problems down the line. Okay, so if the enamel is underdeveloped, the next logical question is, why? Why does this happen? The causes usually fall into one of two big categories. So on one side, you've got hereditary causes. These are genetic things, stuff that's passed down in the family. And on the other side, there are environmental causes, which are basically outside factors that mess with the tooth-building process while it's happening. Now, looking at the genetic side, there are some pretty specific conditions that can be the root cause. For instance, there's a condition called amelogenesis imperfecta, which directly affects how the body builds enamel. These are things that, for the most part, are just inherited. The environmental side, though, is way broader. We're talking about things that can happen during pregnancy or in early childhood. Stuff like a really high fever, a bad fall that injures a tooth, or even not getting enough of key vitamins like A, C, or D. All of these can interrupt the little cells that are working so hard to build strong enamel. Okay, so now that we've covered the why, let's get into the what. How can you actually spot enamel hypoplasia? Luckily, there are some pretty clear visual clues to look for. You might notice little tiny pits or maybe some horizontal lines or grooves running across the tooth. Discoloration is another huge sign, anything from chalky white spots to yellowish or even brownish stains. In some more serious cases, the enamel might just look really thin and worn down, or the tooth could even have a kind of an odd shape. And of course, if you notice cavities popping up in the same spot over and over, that can be a big red flag. This is probably the question on everyone's mind, right? All these spots and grooves, do they actually hurt? Well, the condition itself isn't what's painful, but the results of it definitely can be. Since that protective enamel layer is thin, the nerve inside the tooth has less insulation, and that can cause that sharp, zinging feeling when you drink a hot cup of coffee or bite into some ice cream. But here's the good news. This condition is very manageable. So let's talk about the action plan. Let's look at the toolkit your dentist has to help you out. As you can see, there's a whole bunch of options. For mild cases, something as simple as a fluoride treatment can work wonders to strengthen the enamel you have. Sealants act kind of like a raincoat, shielding the tooth from bacteria that cause cavities. And for bigger spots or pits, things like fillings, crowns, or veneers can actually rebuild the tooth's shape and give it a brand new, strong protective layer. So while we can't always stop the hereditary causes, there are definitely things we can do to manage those environmental risks and protect our teeth for the long run. This really all comes down to creating the best possible environment for teeth to grow strong and stay healthy. Good nutrition is huge, both during pregnancy and for kids. An excellent oral hygiene routine? Absolutely non-negotiable. And hey, for anyone who plays sports, a mouthguard can prevent the kind of trauma that could mess up enamel formation. And this right here is the most important takeaway. Once enamel is formed a certain way, you can't really go back and reverse the hypoplasia. But, and this is a big but, you can absolutely manage it. With the right care, you can protect those teeth from any more damage, get rid of that sensitivity, and make them look great. So if any of these signs rang a bell for you, the next step is pretty clear. Just having a conversation with your dentist is the best thing you can do. They can give you a real diagnosis and help you build a plan that's made just for you or your child. It's really all about being proactive to protect that smile for a lifetime.